Hello again. Welcome to Women's Health Issues, your channel that focuses on health issues affecting women, how they can prevent it, how they can be treated, and symptoms, causes, etc. etc. So today, as you can see on the screen, we are going to speak about vaginal yeast infection. So let's get into the meat of the matter. What is a vaginal yeast infection? A vaginal yeast infection is an infection of the vagina that causes itching and burning of the vulva, the area around the vagina. Vaginal yeast infections are caused by an overgrowth of the fungus candida. So, who gets a vaginal yeast infection? Women and girls of all ages can get vaginal yeast infections. 3 out of every 4 women will have a yeast infection at some point in their life. So that is basically 75% of all women here on earth at any given time, at any given period, will get a yeast infection some point in their life. Almost half of women will have 2 or more infections. Vaginal yeast infections are rare before puberty and after menopause. Are some women more at risk for vaginal yeast infections? Yes. Your risk for yeast infections is higher if you are pregnant, you have diabetes, and your blood sugar is out of control. If you don't have your blood sugar level under control, if you use a type of hormonal birth control that has higher doses of estrogen, if you douche or use vaginal sprays, if you recently took antibiotics or steroid medicines, antibiotics such as amoxicillin, if you have a weakened immune system such as from HIV. So, what are the symptoms of yeast infections? The most common symptom of a yeast infection is extreme itchiness in and around the vagina. Other symptoms and signs may include, but not limited to, burning, redness, and a swelling of the vagina and the vulva, pain when you are urinating, pain during sex, soreness, a thick white vaginal discharge that looks like cottage cheese and does not have a bad smell. You may have experienced only a few of these symptoms. They may be mild, and in some cases, they may be severe. So, what causes yeast infections? It is caused by an overgrowth of the microscopic fungus called candida. Your vagina may have small amounts of yeast at any given time without causing any problems or symptoms. But when this yeast multiplies too rapidly, you can get an infection. Can you get a yeast infection from having sex? Yes, a yeast infection is not considered an STI because you can get a yeast infection even without having sex. But you can get a yeast infection from your sexual partner. Condoms and dental dams may help prevent getting or passing yeast infections through vaginal, oral, or anal sex. Should you call your doctor if you get a yeast infection? Well, yeah. Seeing your doctor is the only way to know for sure if you have a yeast infection and not a more serious type of infection. The signs and symptoms of a yeast infection are a lot like symptoms of more serious infections, such as STIs and bacterial vaginosis, BV for short. If left untreated, STIs and BV raise your risk of getting other more harmful STIs, including HIV, and can lead to problems getting pregnant. BV, which is bacterial vaginosis, can also lead to problems during pregnancy, such as a premature delivery. So, how is a yeast infection diagnosed? Your doctor will do a pelvic exam to look for swelling and discharge. Your doctor may also use a cotton swab to take a sample of the discharge from your vagina. A lab tech will look at the sample under a microscope to see whether there is an overgrowth of the fungus candida that causes yeast infections. So, how is a yeast infection treated? Yeast infections are usually treated with antifungal medicine. See your doctor to make sure that you have a yeast infection and not another type of infection. So please do not self-diagnose yourself. You can then buy antifungal medicine for yeast infections at a store without a prescription. Antifungal medicines come in the form of creams, tablets, ointments, suppositories that you insert in your vagina. You can apply treatment in one dose or daily for up to 7 days, depending on the brand you choose. So, is it safe to use over-the-counter medicines for your yeast infections? Yes, it is, but always talk with your medical professional before treating yourself for a vaginal yeast infection. This is simply because you may be trying to treat an infection that is not a yeast infection. Using treatment when you do not usually have a yeast infection can cause your body to become resistant to the yeast infection medicine. And 3, some yeast infection medicine may weaken condoms and diaphragms, increasing your chance of getting pregnant or contracting an STI when you're having sex. So please, women, go to your doctor. Do not self-diagnose yourselves. How do you treat a yeast infection if you are pregnant? During pregnancy, it's safe to treat a yeast infection with vaginal creams or suppositories that contain miconazole or clotrimazole. So those are types of medications. Do not take the oral fluconazole tablet to try and treat a yeast infection during pregnancy. It may cause a birth defect in your child. So again, please contact your doctor. Can you get a yeast infection from breastfeeding? I'll ask that question again. Can you get a yeast infection from breastfeeding? It sounds strange, but yes, yeast infections can happen on your nipples or in your breast, commonly called thrush. This is spelled Thrush from breastfeeding. Yeast thrive on milk and moisture. A yeast infection you get while breastfeeding is different from a vaginal yeast infection. However, it is caused by an overgrowth of the same fungus called candida. So symptoms of thrush during breastfeeding may include, but not limited to, sore nipples that last more than a few days, especially after several weeks of pain-free breastfeeding, flaky, shiny, itchy or cracked nipples, deep pink and blistered nipples, an achy breast, or a shooting pain in the breast during or after you have breastfed your child. If you experience any of these signs and symptoms, or you think your baby might have thrush in his or her mouth, please contact your doctor immediately or ASAP. If you have a yeast infection, does your sexual partner also need to be treated? Maybe. Yeast infections are not STIs, but it is possible to pass yeast infections to your partner during vaginal, oral, or anal sex. If your partner is a man, the risk of infection is low. About 15% of men get an itchy rash on the penis if they have unprotected sex with a woman who has a yeast infection. If this happens to your partner, you should see a doctor. Men who haven't been circumcised and men with diabetes are at a higher risk. 2. If your partner is a woman, she may be at risk. She should be tested and treated if she has any symptoms. How can you prevent a yeast infection? You can take steps to lower your risk of getting yeast infections. If you do not douche, douching removes some of the normal bacteria in your vagina that protects you from infection. Do not use scented feminine products, including bubble bath, sprays, tampons, and pads. Change your pads, tampons, and panty liners often. Do not wear tight underwear, pantyhose, jeans, or pants. These can increase your body heat and moisture in your genital area. Wear underwear with a cotton crotch. Cotton underwear helps keep you dry and doesn't hold in warmth and moisture. Change out of wet swimsuits and workout clothes as soon as you can. After using the bathroom, always wipe from the front to back. Avoid hot tubs and very hot baths. If you have diabetes, be sure your blood sugar is under control. Does yogurt prevent or treat yeast infections? Maybe. Studies suggest that eating 8 ounces of yogurt with live cultures daily or taking lactobacillus acidophilus capsules can help prevent infection. More research still needs to be done to say for sure if yogurt with these properties or other probiotics can prevent or treat vaginal yeast infections. If you think you have a yeast infection, please see your medical personnel to make sure before you are taking any over-the-counter medicines. So that ends this short lesson on what is vaginal yeast infections, symptoms, and possible treatment methods. So if you like my content, leave a like, subscribe to our channel. The subscription link is in the channel description below. We also have links to other products that we recommend, so if you're interested, you can click on a link, buy one of our products to help support our channel. So until the next time, this is WHI Women's Health Issues. I'm out.